alert from the Department of Health. 2 hospitals in Providence alerting the public and patients that they may have been exposed to measles. A man walked into Rhode Island Hospital last weekend with symptoms of a fever and nausea. Then later in the day, that same man went to Roger Williams Medical Center and his case of measles was confirmed. Eyewitness News reporter Madeline Wright is getting more details now from the Department of Health. She joins us now live with the Providence Mobile Newsroom.
Susan, 14 years ago, measles was considered eliminated in the United States, but now it's on the rise. In February, a man came to 2 hospitals in Rhode Island with measles. The same thing happened last weekend. The Rhode Island Department of Health is getting in touch with several patients who may have been exposed to measles.
Measles is spread through coughing and through the air. So if somebody was near somebody who was coughing, they could potentially be exposed to the measles.
Andrea Dagos, a health department spokesperson, says the potential exposure happened June 22nd. That's when a man walked into Rhode Island Hospital with fever and fatigue.
He did not know that he had measles.
Rhode Island Hospital says against medical advice, the patient left. 12 hours later, he was admitted to a different hospital, Roger Williams Medical Center. By that time, his fever was worse and he had a rash.
The patient was released from the emergency room to home isolation. Meaning he was not supposed to be around other people.
Yesterday, laboratory tests confirmed the man had measles. The hospital says you may have been exposed if you came to the Rhode Island Hospital emergency room on June 22nd between 3 a.m. and 6 a.m. or if you came to the Roger Williams Medical Center emergency room on June 22nd from 6:30 p.m. to 10 p.m.
The best way to prevent it if you've been exposed and you're susceptible is to get a vaccine, preferably within 3 days.
Measles looks and feels like a cold at first, but then the cough, high fever, and runny nose turn into a red rash like this that spreads throughout the body. The health department says measles can stay in the air up until 2 hours after an infected person leaves the room. The health department also says that most people recover from measles without complications, but in rare cases, pneumonia and brain infections can happen. Live with the Providence Mobile Newsroom, Madeline Wright, Eyewitness News.